Number 1, maintain the left margin. Maintain the left margin. Straight down. Straight down from left, from top to bottom. Okay, to maintain the left margin straight down from top to bottom. That means you should start from here. Okay, and you should not leave this space. Actually, you should have started D from here. Doctor, like this. You should have started like this. Okay, but what you did, instead of starting from here, you started from here. Why this gap in between, one letter gap? Okay, you are not supposed to leave that gap. See, everywhere you are leaving one letter gap. So here more, 2 letters gap. Then here again. And here 3 letters gap. Here, you can see. Here more, even more. Okay, 3 letters gap you are leaving. I don't know why you are leaving this gap here. This is not needed. Okay, this gap, you should not use this gap. This much gap is not needed here. So this gap. So too much gap you are leaving. So avoid this gap. So that is left margin. Maintain the left margin. Okay, next. So let us take the address. Next, James Bennet, consultant cardiologist. Okay. So letter, address your letter to Dr. James Banerjee. Yeah, Dr. James Banerjee. Dot should be put above J. Here, dot. Consultant cardiologist. Right. Then Sanditon City Hospital. Sanditon. Okay. Why once it is going in, out, like that? Why don't you write straight away? From top to bottom, straight you have to write. Then next one, 15th May 2021. Yes, you are right. 15 May 2021. This, move it this side. You have to start like this. Okay. 15 May 2021, like this. You should have started from here, from the first dot. But you started from here. So why are you leaving this space? So that's it. Be careful. Then next one, dear Dr. Banerjee. Right. You can put a comma here. You can put a comma here. Dear Dr. Banerjee. Right, fine. Regarding, no space here in between. Okay, and single letter space here. You have put double letter space. Why? So single letters here, no space. And here single letter space. Eleanor Bennet. E. This E. What is this E? Is it cursive writing or normal writing? Write either cursive writing or normal. Any one you use. Okay. Type letters are different and handwriting letters are different. Okay. Regarding column immediately. Miss Eleanor Bennet. Like this you can write. Okay. That's better. Or if you want, you can write the script. Okay. You can use the script also if you want. Okay. Right. So, date of birth here also. Date of birth. You can write in the same line also. Here single letter space. Here double letter space. Why? Here only no space, 0 letter space, and here single letter space. 6th December, your C is not clear. One E is one style, another E is another style. Right? A single style. And your B is looking like H. You think they will give you marks like this? They will think that this is spelling mistake. You don't know the spelling. Like that, they will be considered. So they will not imagine what you have written. Okay, what it is visible. See, this is not C. This is not C. This is not B. This is H. because the gap is there. You can see there. Okay, R is looking like V. Okay, so be clear. Thank you for Miss Eleanor Bennet. Thank you for what? Thank you for seeing. Thank you for seeing Miss Eleanor Bennet. You can say comma, before comma, no space. Okay, already here Miss Eleanor Bennet is there. Why do you want to write everything? You say Miss Bennet. One in a second name is enough. Okay, already here it is there, Miss Eleanor Bennet. Okay, no need. Right. Thank you for seeing. Thank you for seeing, Miss. Okay. So like this, how to write? Regarding Miss Eleanor Bennet, comma, date of birth, colon, 6 December 1975. Write like that. Okay, from here. Okay, start from here. Regarding, no space. After colon, space, Miss Eleanor Bennet, comma, then space. Date of birth, no space, then colon, space. 6 December 1975. Like this, you have to write. That is better. Okay. Right. One line is enough. No need second line. Thank you for saying, Miss Bennet. A 45-year-old commercial lawyer. A 45-year-old commercial lawyer. Okay, where is E? Why it is not visible? Why one letter small and one letter big? R is looking like a V. Okay, why CI joined and other letters are different, separate? AL joined, CI joined, COMME are separate. Why? If you want to write separate, write separate. If you want to write joint, write joint. Okay, that's how you should be. Write any one style code. Okay, don't write different styles. Okay, number 2. Use separate letters or running handwriting, cursive writing. Anyone, either this or that. Okay, anyone. Okay, use either this or that. Either separate letters or cursive letters. Okay, then next one. For review of our medication and encouragement for lifestyle changes. Lifestyle changes. Use better words. Changes. Okay, we can understand. This is good word, no doubt. Now changes. You can use modifications. Na? Modifications. Lifestyle modifications. That's a better word. Na? You're a doctor. Definitely you can use better words. Encouragement for lifestyle modifications. Okay. So now you can check the Cambridge Dictionary. Okay. So changes. What is the power of changes? Power of changes is A1. A1 means 100 marks. A2 means 200 marks. B1 means 300 marks. Okay. So think like that one. B2 means 350 marks. Okay. C1 means 400 marks. C2 means 450 marks. Like that you think. Now this is A1 means 100 marks. So you have used a word which is give only 100 marks out of 500. So why don't you use modifications, a better word? Modification. Modification is C1. C1 means what? 400 marks. C1 means 400 marks. Why don't you use the word modification? Huh? Okay. So make a note out of all these things. Whatever from the YouTube afterwards, make a note. A1 means 100 marks. A2 means 200 marks. B1 means 300 marks. B2 means 350. C1 means 400 and 400. C1. C2 means 450. So to 500. So like that you have to think. So which is the better one? So C1 means If you use modification, you'll get 400 to 450 marks. Why don't you use that one instead of changes? So use better words. Okay. Use quality words. Okay. So I'm writing here. Use C1 and C2 vocabulary. If you are using A1, A2 vocabulary, you'll get 100, 200 marks quality. Okay. So use C1, C2 vocabulary so that you'll get A grade. Okay. Or at least B grade. So regarding her heart condition, why do you want to write you, personal pronoun? Why do you want to write her? Well, I thank you. Thank you for seeing means I thank you for seeing. Why I? So thank you for seeing means I thank you for seeing. That is understood here. I is there. Why I? Why you? Why her? Why her? So many. I thank you for seeing Miss Bennet, 45-year-old commercial lawyer, for review of her medication. Her number 3 and encouragement for lifestyle changes regarding her heart condition. So why 4 words? Simply, na? Are they useful? Are they useful? They're not useful. Then why do you want to use those words? Avoid using ordinary vocabulary. 4. Avoid using ordinary vocabulary. Okay. Next. Number 5. Avoid personal pronouns. I, we, you, he, she, it, they. Avoid them. Number 6. Okay. Avoid using ordinary vocabulary. That means commonplace words. Okay. Commonplace words. That means everyone can use such words. Don't use commonplace words. Avoid personal pronouns. Next one. Avoid active voice. Avoid active voice. Rather use passive voice. Because OET recommends passive voice. OET recommends passive voice. You see, carry carefully. It's there. Okay. You can just check it out here. Because this is the first class for you. I'm showing you here. Okay. OET official. Active or passive in writing and speaking. So what does OET say? OET is here. Official OET. Okay. OET active or passive voice in writing and speaking. You just check it out there. Then you will get here. Occupation. Do you know how to write passive forms correctly? Is asking you here. Do you know how to write passive forms correctly? Okay. Is asking you there. Okay. Passive voice, passive voice. Why passive voice? Just go there and check. Okay. Okay. Passive forms are great. So avoid active voice. That is the meaning. Use passive forms. Using passive forms, it means passive. Using passive forms during writing and speaking subtext can help your language be more sympathetic. So use it. That is what. Using it. It means passive voice. So use passive voice. Okay. As a nurse or a doctor, as a medical professional, you can use your language to build better relationships with patients. You should not say, I am writing you. That other person will get angry. He will say, why only you can write, nobody else can write. Okay. So instead of pitting the performer of the action, who is doing the action? I am writing. I thank you. Why? Why do you want to write like that? Don't write. So instead of actor, who is doing the action? Performer of the action. I is the performer of the action. Avoid that. And the passive voice makes the person or thing acted on the subject of the same. Bring it forward. The passive voice makes the person or thing being acted. Okay. So who is the patient or the treatment? Bring it forward. Okay. Use them. That's what he's telling. Okay. Active voice, avoid. Passive voice, use. OET recommends. I have shown you already. If you want, I'll give you the link for this one. Just to type in the browser, you will get active or passive. Okay. So, yeah. So where I'll give you. Okay. I'll put it in the Telegram channel. I think you know the Telegram channel there. So this is the Telegram channel. I have put it here. You just link it here. You just link it here. Click here and you will go there directly. Okay. So next. So use passive voice. Then number 7. Avoid repetition of words. Avoid repeating words. Okay. So variety is the spice of life. Variety is the spice of life. That means use variety. Don't use monotonous, same word, repeating every now and then. Don't use. So when you are using personal pronouns also, you are using her, all these things. No need. Miss Bennet suffered a heart attack on 8th February following a long haul flight. After being revived with the help of a defibrillator, why there is no space after A? Single letter space needed after the words, between two words. Okay. Number 8. Okay. Leave a single letter space between two successive words. Leave a single letter space between two successive words. Number 9. Number 9. Okay. Next. Thank you for seeing Miss Bennet, a 45-year-old commercial lawyer, for review of her medication condition and encouragement for lifestyle modifications regarding her condition. Okay. So what exactly is it? This is actually side effects of captopril. You know that. Side effects of captopril. Yeah, this is the main thing. Why did you not bring forward? Okay, it was due to, it is diagnosed, the side effects of captopril is diagnosed. Okay, it was diagnosed, you can see here. Emergency hospital admission. Okay, that is done. It is not an emergency letter. Now discharged already, moved to into give care. Okay, so what is that one here? Side effects of captopril. This is the presenting complaint. Okay, he came today with a complaint of side effect of captopril. You can write like this, nah? Huh? You can write like this. So 15th May. So the date is 15th May. Today, okay, Miss Eleanor Bennet, who presented with the side effects of captopril. Okay, Miss Bennet presenting complaint on 15th May. So today she visited. Okay, today she visited. So where exactly? So you have been Miss Janet's GP for 2 years. Okay, and have been treating her. So general practitioner, she came to your general practice. Okay, she came to your clinic. She came to your general practice. Okay, so today she visited. So that's it. Why didn't you write like that? Why are you beating around the bush? Okay, where is that important point? Presenting complaint. Presenting complaint. This is important. Presenting complaint today. Presenting complaint. Side effects of captopril. That is dizziness, lightheadedness. Okay. Presented today with the complaints of dizziness and lightheadedness, headaches, episodes of diarrhea, which are side effects of captopril, or it's already diagnosed. So what you can say? Today, okay, no need today. Miss Eleanor Bennet, Miss Bennet, presented with the side effects. Who presented with the side effects of captopril? Right? Is being referred. Is being, you're writing to a cardiologist, is being referred. So this is a referral letter. Referral letter is being referred. Okay. Is being referred for what? For advice. for advice. Okay, for professional advice or expert advice, and a review of cardiac medication. These are the things you want to write. Why you did not write those things? Okay, again, just straight away you could have written that one. Okay, Miss Bennet, who presented today with the complaints of, or with who was diagnosed with, okay, who presented today with the side effects of captopril, who presented today with the side effects of captopril, or who was diagnosed with the side effects of captopril. Okay, Miss Bennet, who presented today with the side effects of captopril, comma, requires expert advice, requires advice and a review for cardiac medication. Review of cardiac medication. Review of cardiac medication. Okay. Right. Okay. Now here you can say is being referred. Is being referred for. So that's it. So Ms. Bennet, who presented today with the side effects of captopril, is being referred for advice and a review of cardiac medication. So that's it. So request captopril discontinuation. So for that one. Okay. So in addition to that, lifestyle modification for expert advice, expert expert advice, or you can say advice, then lifestyle modifications, lifestyle education regarding lifestyle modifications and a review of cardiac medications. Okay, a review of ongoing cardiac medications. Okay. Right. So you can take it as it is. No? Here it is, everything is here. Presented today, presenting complaint. Okay. Then next, here you can see presenting complaint, presented today. Side effects of captopril is being referred for what? Is a referral letter referred for what? Advice. Number 1, a review of cardiac medication. Number 2, and lifestyle modifications. Okay. So don't use right. So these things you can write. Review of medications is here. Ways to encourage it, that is education, lifestyle modifications. So that's very clear. You can follow that. Next, Miss Bennet suffered a heart attack on 8th February following a long haul flight. After being revived with the help of a defibrillator, comma. Before comma, why so much space? Why so much space? So if you are writing handwritten, you have to change your handwriting. If you are writing computer based, let me know so that you write computer, type and send me. She was urgently admitted. She was urgently admitted to Oakville's General Hospital. Okay. She was admitted to the emergency department, we can say. Okay. On an urgent basis. Or okay, fine. Where a balloon expandable stent. Why this space before and space after? Balloon expandable, no space after comma and before, after semicolon and before. It should be balloon expandable. BALLOON hyphen EXPANDABLE. Like this you have to write. Okay, you cannot leave that much space. Balloon expandable stent, where a balloon was applied via groin. Okay. Fine. Miss Bennet was discharged a week later and was advised to take 4 weeks off work. Okay, 4 weeks already there. So you can write 2 fortnights off work. Okay. She reported increased distress due to her poor relationship with her mother, comma, who moved in to provide care. On discharge, comma is needed here. On discharge, comma. She was prescribed atorvastatin. Why she was prescribed atorvastatin? Just say atorvastatin was prescribed. Finish now. Atorvastatin 80 mg daily and captopril 50 mg twice a day, along with a referral for cardiac rehabilitation sessions, were provided. Here you can say on discharge. Okay, on discharge, atorvastatin 80 mg daily and captopril twice a day. Okay. Okay. Discharge medications. Atorvastatin 80 mg daily and captopril 50 mg twice a day were prescribed. Okay, along with a referral for cardiac rehabilitation sessions, which she has been non-compliant. Okay, non-compliance with cardiac rehabilitation sessions has been noticed. Okay, right, you can say like that. Non-compliance with cardiac rehabilitation sessions has been noticed. You can say like that. Non-compliance with cardiac rehabilitation sessions has been noticed. Okay, non-compliance with cardiac rehabilitation sessions has been noticed. That you can say like that. Miss Bennet presented today with the complaints of dizziness. Okay, this is what it is. Okay. Miss Bennet presented today with the complaints of dizziness, headaches, episodes of diarrhea, along with increased stress, which have been caused due to side effects of captopril. Okay, that's already discussed actually. She has requested for it to be discontinued. Discontinuation of captopril was requested. Why so much discontinuation? Discontinuation of captopril was requested. Finished. She has requested for it to be discontinued and is reluctant to start new medication. Discontinuation of captopril was requested and reluctance to commence new medication has been noticed. Okay. Miss Bennet, start. Now this is start. What is this word start? How small word it is. Okay, new means, okay, right? Okay, start. Start is an ordinary word. Why do you want to use the word start? Okay, START, start. Start is A1, means 100 marks. If you use the word start, you will get 100 marks. And if you use the word commence, you will get 450 marks to 500 marks. Why don't you use quality words? Okay, I'll give you time to speak afterwards. Now I'll not give you any chance to speak because let me go through the flow. Miss Bennet has a stressful lifestyle. Lifestyle is one word, along with frequent international travels, tours and travels, frequent international travels or tours, not one, many tours maybe. So her alcohol spelling you don't know. At least you should have seen in the case notes, no? If you had seen in the case notes, you would not have written this mistake, right? Alcohol, where is alcohol? Alcohol, ALCOHOL. Okay. Increased consumption of alcohol. Okay. Since 2019. Okay, alcohol, spelling mistake. ALCOHOL. Sorry. ALCOHOL, alcohol. Okay. Intake, consumption, you can say, has increased. Her alcohol. Why her alcohol? Why her alcohol intake has increased to 40 units per week. It quadrupled. You can say the word quadrupled from 10 to 40. 4 times, 10 to 40 units. 10 to 40, you can use the word quadrupled. Since 2019, increased alcohol consumption. Okay. Or alcohol consumption quadrupled, doubled, tripled, quadrupled from 10 to 40 units. Okay, which is almost 4 times. That's why quadrupled. Use quality words, na? That is better. And smoking 10 cigarettes per day. Right, this you can write, na? And next one. Per week, and she smokes. She. Avoid she, her. She. Okay. For your review and assessment of Miss Bennett's medication, along with suggestions to encourage lifestyle. Lifestyle is one word. Again, changes. Why changes? Different words used. Feel free to contact me. What is the spelling of contact me for further assistance? Where is C here? Yours sincerely. Yours sincerely. Only one line you leave here. No 2 lines. 1 line. Here, after yours sincerely, 2 lines. Then you said doctor or medical practitioner. Okay, general practitioner. Okay. Leave 2 lines here. 1 line, 2 lines. Then you write general practitioner here. General practitioner. 2 lines leave and then you write. Okay. So I hope you understood. Avoid this. She asked for us. She report increased distress. Increased distress was reported due to poor relationship with her mother. Increased distress was reported. Finished. Right? Increased distress. Again here, increased distress. How many times here? Before comma, no space. So increased distress. Okay. Then here also increased distress. right? You see, increased distress. Words are repeated. I don't know why. Increased. Okay. Maximized. Okay. Some change word. Okay. Cigarettes, a spelling mistake. You see the case notes, no? At least paternal. R is looking like V. She has paternal history. Paternal history or family history? Huh? She has a family history of heart disease. She has a family history of heart disease. That is paternal or maternal? No problem. I would be grateful for your review and assessment of Miss Bennet's medication, along with suggestions too. I would be grateful for your review and assessment of Miss Bennett's medication, along with suggestions to encourage, or is looking like with lifestyle mode. Feel free to contact me for further assistance. Okay, fine. Okay, that is enough for now. Avoid this she, wherever it is. See how many times we are writing this she. So use passive voice, that will help you. Okay. Her. She. Avoid all this as far as possible. Okay, fine. That's good. File. Save as. Okay. Feedback. Feedback. Yeah. Saved. Saved. Yeah. So you can see it here very clearly. So now I'm giving you 1 minute exactly, or 2 minutes maximum. You can share your opinions. Dr. Dhruv, yeah.
Yes, sir. So I have a few questions. First, what do you think is more important, the quality of English or the clinical accuracy?
No, quality of English is more important. This is an English language test. So English language test is considered more priority.
So, sir, like I have seen other videos on YouTube and like I talked with other people. So they always like the OET people always like to pretend that quality of English is not that important as it is a clinical exam and it's not an IELTS test. So that's why somehow in my
1 minute, yeah, I agree with you. I'll just show you. Okay. Don't believe anybody, believe OET. Okay.
Yes,
what
sir.
OET says you believe. Even don't believe me also. Okay. Right?
Yes, sir.
Okay.
Yes, sir.
OET means what? OET. Okay. OET. Okay. Occupational English test. So what does the name refer to you here? Is it English test or clinical test?
Yes, sir. English test.
What is the name telling you? Occupational English test, right?
Yes, sir.
So the English language test for healthcare professionals. It is not clinical test, okay?
Yes, sir.
So whatever anybody is telling you, we are least bothered about it. What is the truth is truth, right?
So, sir, after like reading my letter, what do you think I missed out in the first attempt? Like, why did I score 320? Where do you think I like from all the criterias, all the 5 to 7 criterias are there? So, where do you think I scored less than required, which gave me this score?
Yeah, I already mentioned here. First thing is vocabulary is very poor. Okay.
Okay, sir.
Number 2, grammar is not up to the mark. Okay.
Okay,
Grammar,
sir.
vocabulary and grammar. Number 2. Number 3, presentation and organization is little bit difficult. Okay.
Sorry, sir, I didn't get the last part. Can you please repeat?
Presentation and organization. How you are presenting it.
Okay.
Okay. How you are presenting it. Many times it is repeated. And third thing is you are not using passive voice. Okay.
Yes, sir. Okay, sir.
You are writing it like a personal letter, not like a formal letter.
Okay, sir.
Using personal pronouns, I, thank you for seeing me, for her, you, she, personalized letter. Okay. And give importance to the patient. You are not giving importance to the patient. Okay. Right.
I didn't understand that. What do you mean by that, sir?
So atorvastatin. See spelling mistake here. Can you see here? Okay.
Yes, sir.
Atorvastatin.
Okay,
I missed
yeah.
atorvastatin. You
Yes,
made a spelling mistake.
yes, 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 yes.
Pronunciation. Okay, your R and V both are same. Your R and V both look same. First, what I told you, you improve those areas. Okay.
Yes, sir. Got it.
Handwriting, you improve margins, you improve neatness, you improve. Okay, clarity, you maintain. That is first what I want. Don't expect very great change in the first letter itself. Okay, right?
Okay, sir. Okay, sir.
Whatever I have given you, try to use those things. That is enough. 10%, 5% improvement also is okay, right?
Got it, sir. Yes, sir.
Huh? Okay,
Yes,
fine.
sir.
You can rewrite this letter and send me.
Rewrite this one, or sir, should I try
You
different
rewrite
one?
this letter with modification suggestions which I gave you. Okay,
Okay,
then
sir.
only you can implement these suggestions in the next letter, na?
Okay, sir.
Okay, okay, dear. Take care. Bye bye.
So, sir, should I share this letter today only or tomorrow?
Your wish, whenever you send, that is fine for me, but as early as possible. Don't delay too much. Okay. And along with this, you should write another letter also. Okay.
Got it, sir. Got it, sir.
You revise this letter and new letter you have to write. What are suggestions I
And
gave you that you have to
yeah,
implement in the next letter. Okay.
and where will I find this video on YouTube?
I will send you personally.
Okay, sir. Got it, sir. Thank you, sir.
Okay, dear. Okay.